Good morning and welcome to our bi-weekly Community Engagement Huddle. My name is Deborah Volleson and I'm the Director of Community Engagement for Kaweah Health. And sitting next to me is Gary Herbst, the CEO of our hospital. And today we're going to be answering the questions that you've submitted. Like we say every time, our chat is live. So if you have a question that you need us to answer while we're live, we are watching that chat line. And we appreciate you jumping on a few minutes early today. We have a celebration of life to attend at 1 o'clock. And so we were worried about getting all of the information out to you before we had to leave for that. And there is a lot of pertinent information that we're going to be sharing today.
Yes, lots of great questions.
Yeah, a lot of great questions, and we are experiencing a surge here at the hospital. And so it is very important that we keep you informed so that you can in turn keep those around you informed. So we're going to jump right in, Gary, because I don't want to take time with small talk at the beginning this week. We're going to go ahead and start on the numbers.
All right. Well, again, thank you for accommodating the earlier start time. We really appreciate that, and hopefully we have some good attendance today. I know we're all longing to have one of our community huddles where we don't talk about COVID, and we thought we were getting close to that. Just about a month and a half ago, I think I mentioned to you that we were all the way down to only having 4 COVID positive patients in the acute medical center, and we kind of held steady at that very low level, just waiting for one day for it to actually say 0. Unfortunately, that has not occurred, and we're experiencing, I don't know if this is the 4th or 5th surge. I mean, we've definitely, July of last year, and then Thanksgiving, then hard in Christmas, and but I'll bring you up to speed here shortly. In terms of some of the statistics, so the number of positive cases in Tulare County, as of yesterday, the county reported that there were 681 active COVID cases that they're monitoring. 352 of them came in one day. So that actually was the day before yesterday. They had 352 new positive cases that now are being managed by them. As of this morning, August 5th, we had 53 COVID positive patients that are in the Kaweah Health Medical Center, all adults. We do not have any pediatric patients that are COVID positive at this time. It's been really interesting. Just about a week and a half ago, I reported to the board at their Monday night board meeting that we had 21 COVID positive patients in-house. Slowly ticked up until about Sunday, we were up to 30, and then Monday we were at 40, and then Tuesday we were at 53. So Tuesday was a day of high admissions, but we've been at 53 now for 3 days in a row, so it seemed to be plateauing. Hopefully that's a good sign. You might have read that the United Kingdom, when the Delta variant moved through there, it moved through actually pretty quickly. It came and went. I don't know how long that time period was, but it was rather short. But there were definitely factors that contributed to it, and that, number one, was a high vaccination rate, and number two was very good adherence to mask wearing and social distancing and just practicing good behavior. So hopefully we're able to emulate what the United Kingdom experienced, and we'll see this Delta variant kind of fade away in the coming weeks here. Of those 53 COVID positive patients that are in-house, 10 of them are in the ICU, 8 of them are on ventilators. So that's a pretty high percentage. When we were in the 20 to 30 range, we were encouraged by the fact that we were only seeing maybe 1 or 2 patients that were actually in intensive care, but we saw a very marked increase in the number of admissions that had to go into critical care and then have to be intubated and put on a ventilator. We also are seeing a rise in the COVID outbreak among our employees. We now have 36 employees that are out on a COVID-related leave of absence. 11 of them date back to 2020. So kind of that long haul COVID that they have not fully recovered to the point that they are able to return to work. So we continue to keep them in our thoughts and prayers, and So 11 of those 36, but then the other 25 are new infections that occurred in July. So we have been seeing each day, we're seeing anywhere from 2 to 5 new employees that are contracting the virus. And then the hospital does continue to be very busy, even without COVID patients. As of this morning, we were at 90.4% overall occupancy among the 344 adult inpatient beds that we have in the medical center. Fortunately, we have 16 of our 41 ICU beds are still available. We have 14 of our 54 ICCU beds available, intermediate critical care. But if we ended up using all 14, that would mean in 11 of the ICCU rooms we would have double occupancy. So we can take up to 30 patients in the 3 West ICCU, but we only have 19 rooms. And so we like to keep them single occupancy, but if forced to, we will go double occupancy. And then what's most kind of disconcerting is of the 249 just general medical surgical beds we have, we only had 3 of them that were open and available this morning for a new admission. And 2 of them were in our 12-bed pediatric unit, which we're using as an adult overflow unit. So we try to keep that one open as much as possible, but we had 10 patients in that 12-bed unit. So definitely it's very tight, and I know that we've had some bad experiences in the emergency department. When I say bad, just very, very frustrated patients having to wait for long periods of time. And I understand how people get angry and frustrated. But literally every day when I get the daily email, we have 25 to 30 patients that are in the emergency department. They're in exam rooms, but a decision has been made to admit them. And we're just waiting for a bed to open upstairs. And so that just, it backs everything up. And so, you know, we're still trying to take care of the very high priority, high acuity heart attacks and strokes and, you know, really serious emergent conditions. And so those folks that are in the waiting room with not, you know, out of really emergent or less emergent, I guess, end up having to stay long periods of time. So I apologize for that. We shouldn't be this busy in August. It's generally a slower time of the year for us. But again, we talk about maybe some of that pent-up care that people just delayed during the heavy COVID time period because they were worried about coming into the hospital. Across the nation, we definitely are hearing that people that, particularly those that have chronic diseases like COPD, congestive heart failure, that they really went without care. And now those conditions have exacerbated to the point that they're actually being, you know, hospitalized from them. So I definitely want to encourage people, don't delay your care, you know, take care of yourself, see your, you know, physician, take care of those chronic conditions, continue to take your medications and follow, you know, all the practices that your doctor has recommended for you.
Okay, so since you mentioned the ED, what is being done down there to quickly test patients upon arrival so that they can be isolated from other patients? We received a message that they were commingling COVID and regular patients. So are we testing them quickly?
Well, I'm going to have to read a bit here because I literally was flying out the door trying to get this answer. So everyone is given a mask and they are spaced out when possible due to volume. Now, I do have wonderful breaking news for you. So let me go there first. On Monday, I finally received word from the California Department of Public Health, the Bakersfield Licensing Office, that we've been given the green light to open Zone 5 of the emergency department. My staff and leaders have asked that we hold until August 18th to allow them time. It's been 4 months since CDPH came and surveyed and pretty much said you're good to go. But then held us back for 4 months as we dealt with the CMS survey, the diversion issues we had, and then staffing. But We've now satisfied all of that, so we will get to open that beautiful new 24-bed ED Zone 5 with a 100-plus seat waiting area. So right now the waiting area, the lobby we're using, is not even an ED lobby. I mean, we pretty much have just commandeered space, so we don't have the normal capacity that we would have. So unfortunately, that doesn't allow then us to do that social distancing that we'd like to. We are, one action we've taken is, and again, I realize the frustration this causes, but we do not allow visitors in the waiting area unless it's absolutely essential that a patient has a caregiver there with them. So we're trying to unclog the waiting area and only have it for patients that are waiting to go back and be treated in an exam area. So it does require that then the visitor, the patient, the person that brought them to the emergency department has to wait out in their car or wait at home. We are, just a couple days ago, talked about putting benches and seating and umbrellas out front. We realize it's very hot. So that is something that we've done that at least will allow us to be a little bit more distance in the waiting room. We do also, and will continue, we'll be making an announcement, I think maybe as early as today, because of the significant outbreak in COVID and some of the regulations that are being imposed upon us by the state, which I'll talk about after a while, that we are having to go back to a more restrictive visitation policy. But we are still going to allow one person, once the patient goes back into the emergency department, back into an exam room, that somebody can go back there with them. So while they can't be in the waiting room with them, once they're back into an exam room, then they can go back and be with them. Now, if someone is actively coughing and is suspected of having COVID, we move them to a room as soon as possible to isolate them from other people in the lobby. And then definitely once the Zone 5 opens in the new lobby, we'll have a lot more area to space patients out. Then the question, are they still separating COVID positive patients in both the ED and medical center? So patients are placed in isolation for COVID positive status throughout the organization. So when we started experiencing this breakout, once again, 2 South became a dedicated respiratory care unit. It was the very first when the outbreak first occurred. So they are now back to being dedicated for COVID, and they are full. Then we moved to 3 North as our next respiratory isolation unit. So we cohort COVID positive patients that are up in the medical center, that they are an inpatient. We definitely separate COVID positive from COVID negative patients. And we just made a decision yesterday to turn the ICU and 3 West back into negative pressure units. So every single room will be negative pressure, which does not allow COVID transmission outside of the room. So the ICU and 3 West are mixed units, but with negative pressure, we essentially can isolate the flow of any transmissible infections.
Okay, so is there any way to find out if the new cases are spread out across the county or if they are concentrated in certain areas?
Yeah, I was really trying to get that answer. There is a county website that I use, that I go to often, that has their various dashboards. And one of the dashboards that I've looked at in the past was to actually look by every single city that was in Tulare County and see the number of COVID cases. And I think one of my reports, probably months ago, I kind of went down, and obviously Visalia, Porterville, Tulare are probably where we see the greatest concentration of COVID cases. And I would imagine that most of the new COVID cases are coming out of those 3 major cities of Tulare County. But if I remember, almost every city throughout the county had some level of COVID cases. So their website was down this morning. So it was frustrating that I don't know if this specific question, if number of new cases are displayed by city, but they definitely display the number of total cases that have been seen in those cities. So unfortunately, I don't have that information for this morning, but I would recommend going to the COVID-19 Tulare County website, and you'll see their statistical dashboards on there.
Okay, you mentioned just a few minutes ago that there is always a concern about people not seeking care due to surges like we're experiencing, and we don't want that to happen. But the question is, does Kaweah Health or the county collect information on previous infection to see if reinfection is happening with those people, or is this with vaccinated or unvaccinated?
Yeah, so that definitely that information is being collected at the county level. So every new positive case that we test at Kaweah, and our testing is definitely ramping back up. We're doing a lot more COVID testing, and we send those results to the county, both positive and negative. We also send the specimen itself for all positive cases. We send it to the county so that they can test it for the variant. So they're doing the DNA sequencing locally at the Tulare County lab. We can't do it here at Kaweah. We just don't have the DNA sequencing platform here. Although I wouldn't put it past Randy Coca to be developing something. But so we do report, again, every test we do, whether it's positive or negative, we report those test results to the county. Then the county follows up with every positive patient, and I believe is asking them, have they previously been infected or have they previously been vaccinated? Because we call these breakthrough cases. When somebody has been fully vaccinated or has previously had the virus and gets it again, or if you've never had it but you're fully vaccinated but you end up contracting it. So those are breakthrough cases, and the county has been reporting. I don't know if it's on their website or not. What we started doing beginning July 1st, every patient that now is admitted for COVID, we ask them if they've ever had COVID before, and if so, when. And we ask them, have you ever been vaccinated? And if so, when? So we just started collecting that data back on July 1st. And so for all the admissions into the hospital of COVID positive patients, roughly 85%, because it's not exact, because sometimes our patients, their recollection is not as sharp, or just their condition makes it difficult to really understand the accuracy of their information. But we think it's about 85% of all of our COVID admissions since July 1st are of unvaccinated people. So that still leaves 15% of the admissions are either fully vaccinated people, because I would count the partially vaccinated as unvaccinated, but fully vaccinated or previously have had COVID, about 15% of our COVID admissions are those kinds of patients. So we definitely, this Delta variant, and we'll talk about variants in a little bit, but when the Delta variant was first identified coming out of India, all of the drug manufacturers, Pfizer, Moderna, and Johnson & Johnson, along with all the scientists that helped develop them, they still felt that the vaccines were very effective against really preventing severe or serious illness, hospitalization, or death across any of the variants, including the Delta variant. But they definitely said the Delta variant is the most contagious, most transmissible of all the other variants, about twice as contagious as the original SARS COVID-19. but that it was more elusive in our bodies. So we could have the antibodies from vaccination or previous infection, but the Delta variant was able to somehow elude those antibodies more effectively than the other variants. And that's why we're most likely seeing these breakthrough infections. But also it could be, and I'll say it's speculation on my part, but I think there's a lot of people that feel this way, that, that scientists believe that both the vaccination, the immunity that you got from vaccination or the immunity from natural infection would last about 6 to 8 months. All of us in the room here at the hospital got vaccinated back in December. So we're in month 8, month 9, and maybe we're seeing some of that immunity start to decline in us, and that's why you're seeing more infection and more hospitalization of younger people and healthier people are in fact being hospitalized. But we haven't, Tulare County hasn't reported a COVID death in some period of time. None were reported for this last week, so that's encouraging, and certainly you know, we're very concerned for the unvaccinated, but I think we're seeing that the vaccination is still proving to be quite effective at preventing death and really even hospitalization.
Okay, during the last webinar, you said we were not testing specifically for the Delta variant here.
We are not. We don't have that capability. They can test it at the state level. I was not aware when we last talked about it that we're doing that at the local Tulare County level. But the Tulare County lab that's located in the city of Tulare, they have the DNA sequencing laboratory platform, and that's why we send them all of our positive specimens, not just the results, but we actually, in a test tube, we send them the specimen so that they can run the DNA sequencing. What they've reported back to us is that 95% of the COVID cases that we're seeing today are the Delta variant, and 5% of them are the Alpha variant, which came out of the United Kingdom. So pretty much, well, clearly the dominant strain or variant that we're seeing right now is the Delta variant.
So this will kind of make you smile, but I was at a community meeting early this morning, and somebody came up to me and said, "Did you guys change your name because of the Delta variant?"
I joked about that the other day.
Yeah.
I go, so we were so upset at the arrival of the Delta variant that we removed it from our name. So
yeah, that was cute. Okay, so you talked about our immunity possibly starting to wane. So yet nobody's talking about a booster. Nobody's talking about a third shot, except one of our community members. She sent us a message and said that her father-in-law, who lives in Israel, is getting his third vaccine. But when she tried to look it up, the World Health Organization director is calling for a moratorium on booster shots until other countries can get caught up with vaccinations. So what do you know about that?
Yeah, so there is a lot of work and discussion going around right now about developing a booster vaccine. Pfizer, I think, is kind of leading the way. So I don't know what a booster is necessarily going to look like. They have been talking even from the very beginning that you know, generally when you contract the virus, it colonizes in your nose. And so that's where it starts, and then it kind of, you know, makes its way down into your respiratory system and causes that storm to occur in your lungs, because, you know, it is an acute respiratory syndrome. That's what SARS stands for. And we get the vaccine as a shot in our arm. So it's intramuscular, which does provide, you know, protection throughout our system, but how much of it really then makes it up to our sinuses and our respiratory tract. And so they talked about that the booster would actually be like a nasal spray, so that it would have greater concentration in our respiratory system, which I thought made a lot of sense. I don't know where they stand with that. A lot of folks now are talking that simply get a third shot.
Of the same
Yeah,
vaccine.
so if I got 2 shots of Pfizer, which I did, just use the exact same vaccine that I got back in December and just draw another shot and give me a third shot, and that'll replenish, recharge my my immune system. So there is a lot of discussion around that. No doubt about it, Israel is kind of a center of research and study. They're doing a lot of great work, and a lot of things that we learn in the U.S. are coming from Israel, and I believe that we're in constant communication with them to share ideas and observations. Yeah, one of the directors, I don't know if that's his title, of the World Health Organization just came out, I think it was yesterday, I read it in the paper today, that is very concerned that the wealthier countries like the United States, countries in Europe, have had significantly greater access to vaccines, and that we have some of the highest vaccination rates, but you go to poor countries and they have virtually no vaccination. Countries that only have 1%, 2% vaccination because they don't have the vaccine or the infrastructure to deliver the vaccine. So it's understandable that the WHO would come out and say, hey, before you start giving these wealthy countries and its citizens, a third booster shot to protect them, why don't you redirect that vaccine, which we have. President Biden has shipped a significant amount of vaccine to other countries, poorer countries. So that's what they're advocating for, that there should be greater vaccination equity across the world.
The flu, a new variant comes out every year, and the flu shot, is different every year. So you would think it would make sense that with each variant would come a new vaccine.
Yes and no, I guess. So when we get the flu vaccine every year, the scientists, the drug companies are trying to predict, what the next flu strain is going to look like. And it's a melting pot of various flu strains. And so they try to make a vaccine that might cover 6 or 7 different strains. And they're kind of guessing, because you're right, the flu does mutate. You don't always see the same H1N1 or H13B or whatever they happen to be. You don't see that every year, and sometimes the flu vaccine is very effective, sometimes 75, 80, 85% effective, and we've seen years where it was 20% effective. I think 2017, we had a high rate of vaccination, but an incredibly high prevalence of the flu, and a lot of hospitalization and a lot of death, and because they essentially guessed wrong. And so the effectiveness was very, very low. The COVID vaccine, which is the messenger RNA development, a new type of development of a vaccine, when they came out with it, you're right, they were targeting a specific virus, the original virus. And they were, the vaccine is a molecule made up of fat, sugar, salt, and then the mRNA molecule that goes into your body and kind of tricks your body and causes it to create what appears to be the COVID virus, and then that triggers your immune system go attack it and creates all the antibodies and everything. So the coding that they put in that mRNA was specific to that strain of the virus that was out at the time. So now as these variants have come along, scientists have been testing to see how effective that original vaccine is against these variants. And we have, just like the flu, we have 4 variants. The B.1.1.7 alpha variant, which came out of the United Kingdom, the B.1.351, which is the beta variant that came out of South Africa. Much easier to remember, P.1, the Gamma variant that came out of Brazil, and now the B.1.617.2 Delta variant that came out of India. So yeah, they know just like H1N1, they know the strain of this variant, but they've determined that this original vaccine that we're all taking appears to be effective against all four of these variants. Maybe not to the same degree, maybe not as effective against the Delta variant because of that elusiveness that it seems to be demonstrating. But remember, these vaccines were not designed to keep you from contracting the virus. They were designed to keep you from getting severely ill from the virus, being hospitalized, or dying of the virus. They never said that they would prevent you from getting it. But as time passed, they found that they actually were pretty effective in preventing you from getting it, and if you did get it, preventing you from transmitting it to somebody else. So this particular Delta variant, we definitely are seeing more fully vaccinated people contract the virus. And interestingly, the tests that have been done are showing that the viral load in somebody's nose from contracting the virus is about the same whether you've been vaccinated or not. So you could be fully vaccinated, get exposed to the virus, have the viral load in your nose and now be very contagious and transmissible, but you're probably not going to get severely ill. And that's what we're seeing, is that although we are obviously seeing some hospitalization, we haven't seen any death yet from the breakthrough infections. But I think that's, again, what the goal was, to keep you from getting severely ill, not from getting infected. And it still seems to be very effective at that goal across those four variants. And so that's why they really haven't, driven to develop, okay, we now have to create a new vaccine to fight the Delta variant or the next variant that comes along, because they still think the goal is being met, and rather I think are focusing on a booster, or do you get a third shot? I think the thing that is disappointing is we haven't seen the therapeutics. So when you do think about the flu, somebody that tests positive for the flu, we give them Tamiflu or other antiviral treatments that, if caught early in the stage of their infection, can be quite effective in reducing, the symptoms and making it less severe. And we really don't have yet any therapeutic treatments for people that have contracted the COVID. That's something that, there's remdesivir and dexamethasone and, things like that, but they're not therapeutics for, they're therapeutics for other conditions and diseases. We just happen to be experimenting with them. So I think we would have thought that there'd be more therapeutics, but obviously all the focus was on developing effective vaccines.
Right, so we've been pushing for people to get vaccinated, but then you have the argument, well, if I'm going to get it and I can spread it, then why get it? Why get the vaccine? If I'm going to get the virus,
so you won't die.
So you won't die.
Right. Yeah.
Okay, so
that's basically, again, when I was vaccinated back in December, I knew that I wasn't protected from getting the virus, but I felt, peace of mind and confidence that I would not, if I did contract it, I would not be severely ill, I wouldn't be hospitalized, and I wouldn't die. So that's why I got it. And that's why I'd say get it today, because it's still absolutely proven to be effective in preventing that very severe illness or death.
So what about the argument, I had COVID, so I don't need the vaccine?
And it's a good argument. It's a good argument. We did, a year ago, back in, I think it was May or June of 2020. So the virus broke out here in Tulare County in March of 2020. We had a lot of our employees contracted the virus. both symptomatic and asymptomatic. And so by the time we got to June, they were very curious. Did I have COVID? Or I know I had COVID. I tested positive. Do I have antibodies? So we tested about 3,000 of our employees for the presence of the COVID antibodies. And interestingly, only about 3.5% tested positive for the antibodies. So it was very young, early in the course of this pandemic. So we thought, well, maybe the antibodies only last a few months. We had people that were really, really sick with COVID, and they tested negative for antibodies within just a few months of contracting it. So yeah, if you've had, I've heard many times that the immunity that's created from having contracted the virus is just as strong, if not stronger, than the immunity created by the vaccine. So yeah, if you've had it, do you need to be vaccinated? The CDC says you should, just an added layer of protection. Maybe you have a super load of antibodies, and so you're even, more protected. But I understand people that are not taking the vaccine because they think they've got the natural immunity, and they very well do.
So this question came in, can you please clarify for the community that the spread of the virus isn't only because of unvaccinated people? Yet I'm hearing the same thing on the other side. We were with some people a couple of weeks ago, and somebody said, it's all you vaccinated people that are spreading it. So both sides are...
Yeah, well, both sides are wrong, but both sides are right in terms of you've got vaccinated that are spreading the virus and unvaccinated that are spreading the virus. So as I just explained, we definitely are seeing with this Delta variant that fully vaccinated people are contracting the virus, and they have a similar viral load, and they are transmitting it to other fully vaccinated people and to unvaccinated people. Unvaccinated people are definitely more likely to contract the virus than fully vaccinated people. But again, the Delta variant is proven to be pretty elusive. Generally speaking, we've had a number of employees that were fully vaccinated that are now contracting the virus and testing positive. But in almost every single case, their symptoms are mild to non-existent. So that's why you should still get vaccinated. But it is a reason that you're seeing the CDC recommend that even vaccinated people now wear masks while indoors. And that's in recognition of the fact that fully vaccinated people now are contracting the virus and that they easily can spread it to unvaccinated people. And I know a lot of people will say, well, hey, too bad, so sad. You chose not to be vaccinated. So that's your decision. And why should I, as a fully vaccinated person, I got vaccinated so I didn't have to wear a mask anymore and I could have some normalcy in my life, and now I have to wear a vaccine because people don't get vaccinated. And I understand that argument, but I care enough about my fellow human beings that, while maybe I don't agree with their decision not to get vaccinated, I still want to protect them. I have family members that have decided not to get vaccinated, and I don't want to get them sick just because, out of spite or to show them.
Right.
Yeah.
So what about the hot button question about mandating vaccines for employees? What's Kaweah Health's stance on that?
Oh my gosh. Yeah. So July 26th, I think it was, so I guess that was last week, Tuesday or something, Governor Newsom published a new executive order, a health order, that effective August 9th, all healthcare workers across the state, as well as all state employees, so not city or county, but if you're employed by the state of California, that number one, you had to show proof of vaccination if you were vaccinated and claiming to be vaccinated. And if you're unvaccinated, you now had to be routinely tested for COVID-19. From a healthcare institution standpoint, the frequency of the testing and exactly which healthcare workers have to be tested varies. So employees, contracted personnel, providers, doctors, PAs, NPs, vendors, literally anybody that comes and works in the acute medical center, if you're unvaccinated, you have to be tested twice a week for COVID. And if you test positive, then you go through the normal quarantine process. And same with employees that work in congregate living places like memory care centers, skilled nursing facilities, nursing homes, assisted living facilities. They all need to be tested twice weekly. Acute psychiatric facilities are once weekly. We have made a decision at this point that we're going to follow the governor's health order. And it's abundantly clear, and pretty much the governor and everybody has said it, that the objective here is not to increase testing, but is to make it so difficult to be unvaccinated, to make your life so uncomfortable to be unvaccinated that you finally say, okay, I'm not going to get tested twice a week. I don't want to wear a mask wherever I go, and so I'm going to get vaccinated. So that's the whole purpose behind it. Because I can tell you, it's very tempting for us, because if we don't go to mandatory vaccination, which we're not going to at this point, then we have to perform about 4,000 tests, COVID tests, every week to cover. We're 55% vaccinated, our 5,100 employees, 45% are unvaccinated, and about 57% of our 700-person medical staff is vaccinated. So 43% of them are not. So now they all need to be tested. Several thousand people need to be tested, some twice a week, some once a week. And so we're estimating, it's 4,000 to 5,000 tests we have to do every week. And just logistically, from a supply standpoint, just trying to accomplish that is going to be quite challenging. It goes into effect August 9th, and we have to be fully compliant by August 23rd. And I guarantee we'll have CDPH surveyors coming on site and checking us out and making certain we're compliant. And if we're not, we'll get fined and cited. There are hospitals, many now, increasingly across the country, that have decided to make vaccination mandatory. Locally here, St. Agnes Medical Center announced several weeks ago that effective, I think, September 21st, they're going to require mandatory vaccination. Earlier this week, Valley Children's Hospital also announced that they are going to mandatory vaccination, I think in September as well, might be October. Adventist Health Hanford and Tulare, Community Regional Medical Center in Fresno, and Sierra View Medical Center in Porterville have all indicated that they are not going mandatory. It's interesting, I think a lot of the decision for a hospital to go to mandatory or not has to do with their workforce. So I'm worried that our workforce is depleted because unvaccinated employees become sick with COVID and are quarantined at home, or, God forbid, end up in the hospital or die. But at the same time, if we mandated vaccines to keep our employees safe, then I potentially have many employees that will quit Kaweah and go up to Community Regional or go over to Hanford or go to Sierra View, where they don't have to be vaccinated because they don't want to be vaccinated. So you have hospitals, and I've read this across the country, that are kind of watching what their neighboring hospitals are doing. We just heard, I don't know if it was, I think it might have been this morning, we had one of our vice presidents was on a call with the county, who has been speaking to the state and understands that Governor Newsom may issue a new healthcare order tomorrow, as early as tomorrow, that will now make it mandatory for healthcare workers statewide. Mandatory. There'll be religious and medical exemptions, which will be interesting to see how those are defined, and that mandatory vaccination can be done at the state or local level. Cities, counties, and states can mandate vaccination. The federal government cannot, but state and local governments can. So the governor does have the power to make it mandatory statewide. Our fear is we will now have an exodus to other states because we'll be the only state that makes it mandatory for healthcare workers. Right now, Kaiser has made it mandatory statewide. We now have nurses from Kaiser that have applied here at Kaweah, leaving Fresno and coming to Kaweah because we don't mandate it. So if the state mandates it, then our healthcare workers go to Texas and Idaho and Nevada and other close by states that don't mandate it. So I'm all for vaccination. I am a big proponent, an advocate for it. I trust it, I believe in it, I think it's safe, and I like the peace of mind that it gives me. But I also am pragmatic and a realist, and so I have great fear that that kind of mandate is going to have dire consequences.
So we have a chat. If we find ourselves admitted to the hospital, can we request that only vaccinated staff are allowed to take care of us?
Well, a patient definitely has rights. I mean, they can make that request. I don't know if we can always accommodate it, given that 45% of our employees, and many of them nurses, I will tell you that effective earlier this week, every clinician that works on a unit, every nurse, every LVN, respiratory therapist, pharmacist, if you're in the hospital, whether you have COVID or not, those clinicians now are wearing a tightly fitted N95 mask, as well as a face shield and all personal protective equipment. So I think you are safe, even if they, now understand too that beginning in just a week, we also will be testing twice a week all those nurses that take care of you, all those unvaccinated nurses. They will be tested, and if they test positive, we will remove them. But in the meantime, they're fully donned in all that personal protective equipment. Even fully vaccinated nurses will be wearing N95 masks and shields. So again, because it's possible to become infected even if you're fully vaccinated and to be asymptomatic, we now are requiring face masking at all times. In fact, Kaweah has gone even a step further. I know we're Deborah and I are not vaccinated right now. We make these unique exceptions. We're distanced, but I was just in a meeting with our entire executive team, and it was in a building away from the medical center. There's no patient care that's provided in it, but all of us wore masks, and we're all fully vaccinated. So essentially, we've reinstituted mandatory mask wearing across our entire organization, vaccinated or not. Out of an abundance of caution and to protect one another and to protect our patients and our visitors.
So does the state have a plan if there is a mass exodus of nurses?
No, no, not, no. And I don't know if for certain that it's going to happen, but we were being told this morning by the county health department, who is working very closely with the state health department, and that's what they were being told. But no, I don't think there's any plan. It's just like, I mean, it's very frustrating. I mean, this, you know, once again, a mandate comes out of the state for us to now, you know, perform 4,000 to 5,000 tests a week on our employees, and we pay for it. The state doesn't pay a penny. We can't charge our employees because It's a covered benefit. It's a federally mandated covered benefit to be COVID tested, so employers have to pay the cost of it. So we think it's going to run up into the millions, what we are going to have to. And it's also one of the reasons that hospitals are mandating vaccination, is the avoidance of the millions of dollars in costs to test. And I fully believe that the governor took that into account, and it's the reason that we're not getting funding from the state, because not only make it miserable for the unvaccinated employee, but make it miserable for the employer, so that you push them into mandating it. I can tell you, if we were to mandate it today, we would lose probably 100 nurses that would leave and go to Hanford, Fresno, Porterville. We already see nurses leaving the profession right now out of fear of contracting the virus, and now there's still just so much vaccination hesitancy. I think what would make it so much easier if the FDA would make it certified. It's emergency use authorization. So they're allowing us to use these vaccines only because of the emergency condition we're in. And that causes a lot of hesitancy. And I know the FDA is very methodical. They don't want to tarnish their reputation for, being very careful and thorough with their analysis of vaccines, and don't want to put their stamp of approval on it until they feel absolutely confident. I think they're still probably months away from achieving that, but they have been just recently reporting on that, and they know people are getting anxious.
Okay, although you said you're not 100% confident in the information that patients give us when we ask if they're vaccinated or unvaccinated, but can we add that metric to our COVID-19 dashboard?
Yeah, in fact, I spoke to Doug Leeper, our Chief Information Officer, last week. Now that we started capturing that information, asking that question at point of admission, we do want to add that to the dashboard. So he's working with his team to add that. And my motives, I'll be honest with you, that I do want the public to see that the vast majority of our hospitalized COVID patients are unvaccinated. I will continue to encourage people to get vaccinated. And I guess I don't mean it as a scare tactic, but unfortunately I've had friends and relatives who have died of COVID, and they were all unvaccinated. And so it's personal to me. It's personal to a lot of people that have lost loved ones that we think could have been prevented had they been vaccinated.
All right, thank you. And the question was asked about us publishing data that shows which strain people have, and we cannot do that here because we don't test for it here.
Yeah, we don't. I mean, I'll report on it as frequently as I can, because we do get that feedback from the county. And again, once I can get back onto the county's website, it's quite possible they could be publishing it there. But I think that I learned of that 95% Delta variant, 5% Alpha from Randy Coca, our director of lab, who spoke to the county. So I don't know if this is public information that they're publishing, or we just happen to, because we're the primary supplier to them of the specimens that they use to test for the variant.
Okay. Well, we've answered all the questions, Gary. So
okay.
I'll let
How'd I do on time?
You
Pretty
did great.
there?
We have
All right.
5 minutes left, so you can go ahead and close us out.
Again, thanks for tuning in. I hope that you found this to be informative. While again, I would love to answer as many non-COVID questions as possible. I do know that COVID is top of mind right now, and I want to continue for Kaweah Health to be your source of truthful, factual information, and we won't ever make anything up. If we don't know the answer, we will tell you that. So keep tuning in and keep your great questions coming, and thank you again for just being a part of our community engagement team, and being our ambassadors and spokespeople out there. And definitely when you can connect and provide information to the community, That's of huge benefit to us, and we definitely want to hear your feedback too, things that you're hearing out there in the community, and it only helps make us a better organization. So thank you, and I hope you all have a great day and a great weekend.